afternoon all, respected faculty and the assembled doctors in this hall. Firstly, I would like to thank the organizers for permitting me to present this paper titled The Traumatic Childhood Experiences, Psychiatric Comorbidities in Path Analysis of Suicide Attempters. The guide of which was Dr. B. Shivshankar Nair and the co-guide was Dr. T.S. Jayasurya. At the background, as we all know, suicide is deliberately killing oneself as per the WHO definition, and DSH is a strong predictor for suicide. And as per the WHO fact sheet of 2016, almost 8 lakh people commit suicide per year all over the world, and of which 75% occurs in the low and middle income countries. And the national statistics of India, the annual suicide rate is about 10.6. And Kerala accounts for about 6.4% of the total nationwide suicide. But in the state of Kerala, per se, the suicide rate is 23.9 in 2014. Now, this is disproportionately high when compared to the high literacy rate in Kerala as well as the availability of the health sector. Now, several factors make an attempter vulnerable or unfavorable to cope with the unfavorable circumstances. Now, previous studies have shown the association of suicide with psychiatric comorbidities, psychological problems are common among suicide attempters, and child abuse, namely the physical abuse, emotional abuse, and sexual abuse is quite common among suicide attempters. Now, the relevance of this study is hardly any few studies have been done in India to assess the association of multiple factors to suicide through the statistical method of path analysis. Now, the aim of the study is to find out an association between the suicide attempt and the following variables, namely the childhood traumatic experiences like physical abuse, emotional abuse, and sexual abuse, and personality profile of the individual and the psychiatric comorbidities. The methodology, it was a case control study. The cases were about 78 suicide attempters selected from among the inpatients of a tertiary care teaching hospital with a true intent to die, assessed by the Pierce Suicide Intent Scale, and the control group consisted of 76 control patients of age and gender matched control group selected from among the bystanders in the non-psychiatric patients admitted to the same hospital with no history of suicidal behavior. And the study setting was the Department of Psychiatry, Government Medical College, Ernakulam. And the duration was 18 months, and the inclusion criteria was a suicide intent with a true intent and with informed consent. Exclusion criteria were accidental injuries with no intent to die and those who do not consent to the study and who are seriously ill. Now, the sample size was 154, inclusive of 78 cases and 76 controls. Justification was using a proportion of depression in cases of 70% and controls of 40% with a power of 90% of the study and an alpha error of 5% in the study for a two-sided test. The required sample size is 74. The study's tools were a detailed case history proforma, a skit like the structured clinical interview according to the DSM for Axis 1 and Axis 2 disorders, the childhood experience of care and emotional abuse questionnaire, and the measure of parenting style, both and the temperament and personality questionnaire. All these three, namely the 4, 5, 6, were the self-administered tools and where the individual retrospectively thinks about or gives you the answers to the care and the emotional neglect or the emotional care given by the caregivers, including the parent, the foster parents, etc., as well as by the temperament of the individual, that is prior to 15 to 17 years. Now, the Pierce Suicidal Intent Questionnaire and the Global Assessment of Functioning. The statistical analysis was done by comparison of the variables between the cases and controls using a chi-square test, and in addition, a logistic regression analysis of the various variables was done to study the strength of association of the various factors, namely the parenting styles, the early traumatic experiences, temperament, suicide intent, psychiatric comorbidity, and personality disorders to the final outcome. And regression was also used for path analysis using SPSS 16. The results were there was not much variation between cases and controls in respect to age and sex. And comparison of the family history, it was noted that there was a positive history of psychiatric illness in 61.5% of the subjects, and marital satisfaction was only 6.4% among the cases. The family conflicts in cases was 96.2%, and the domestic violence was 80.8%, and substance use was 41%. And the parenting style, among the mother factors, it was indifference was more common, that is 56.4%, and among the father, it was abuse, that is 48.7%. And when you compare the CQ, the psychological abuse due to maternal factors was 84.6%, and the physical abuse was 82.1%. And in the father, it was psychological abuse was 93.6, and the physical abuse was 87.2 was in the father. And the sexual abuse, there was about 13.5% among the cases reported as sexual abuse, of which 29.5 was mild and 9% was severe. Now the SCID 1 and the SCID 2, the SCID 1, the psychiatric illness was 93.6 among the cases, of which depression was 42.3% and psychosis was 15.4%, and the personality disorders, among the cases it was 78.2%, and borderline personalities was 30.8%, histrionic was 16.7%, and paranoid 7.7%. Now this is a path analysis and this is a path diagram. Of these, only the important path has been highlighted in this diagram, of which you can notice that the psychological factors leading on to suicide attempt was, the coefficient was 4.169, and the sexual abuse leading to psychological factors was 3.598, and sexual abuse leading to suicide attempt was 3.14%. And the personality factors on the left upper side, that leads to suicide attempt was 2.946, and the psychiatric illness leading to suicide was 1.436. And the rest of the others, which were more important, was the family history leading to psychological factors, and the marital satisfaction leading to psychological factors, and the marital satisfaction 2.254 leading to suicide. The rest of the thing, and one point to be highlighted was the paternal factors were more significant when compared to the maternal factors. The paths, just I explained, the significant paths were the psychological factors to suicide, and the following paths already elucidated, and the sexual abuse to suicide.
Dr. Ramya, I got one more minute.
Okay, sir. The discussion was average age in the cases was 31 to 40 years group, adolescent accounted for 26.5%, females were 66, psychological factors were 93.6%, and positive family history of psychiatric illness is 48 cases. This is comparable to the previous studies. And the paternal bonding influences in DSH attempts was comparable to Suletar study, wherein the paternal abuse is more when compared to the maternal abuse. There is a strong association of physical abuse and neglect and psychological abuse and sexual abuse. The conclusions are, study gives an important insight into the causal pathways leading to suicide attempt, which is implications in the management and prevention of suicide behavior, and a large number of patients who had significant stresses that affected their temperament, their coping skills, impulsivity, and personality, all of which need to be addressed to reduce the individual risk to a further suicide attempt. And a multifactorial approach is needed, as several of the predisposing and perpetuating factors have to be addressed in the management and prevention of suicide attempt. Thank you. And few of the references that I have taken is this. Thank you.
Any questions for Dr. Ramya? You can raise your hands if you got any questions. Dr. Ramya, let me ask you a question. The path analysis, the numbers that they represent,
Yes.
what do they indicate?
That indicates only the strength that is more significant between the associations. There are other minor significances were there, but when we did the case control study, there are several factors which are more significant. Like for example, the temperament was significant. But in the final path analysis, the temperament was not much significant when compared to the rest of the factors elucidated.
So is that like an odds ratio?
Yes,
Like
yes.
a relative risk or odds ratio?
Yes.
Thank you.
Thank you, sir.
All right. Thank you for your presentation. I appreciate it. Can I have the next speaker?